Now, live on WPRI 12 and on WPRI.com, this is Eyewitness News at 6:30. Coverage you can count on.
Welcome to our latest 12 Town Hall. The question on so many people's minds over the last several months, children and going back to school. Will they be in person? Will it be a hybrid situation, or will it be remote learning? Tonight, we're going to tackle that issue. Plus, how is the minority community dealing with that? I'm Mike Montecalvo.
And I'm Courtney Carter. This evening we have Rhode Island Education Commissioner Angelica Infante Green. We have Harrison Peters, Providence School Superintendent. We have Jim Vincent from the Providence NAACP and Dr. Lacella Hall from the New Bedford NAACP. And I'll have Mike start with the first question.
All right, thanks, Courtney. Commissioner, we're going to start with you. You said something last week at Governor Raimondo's news conference that really kind of struck me, and I think he kind of painted the picture of what a lot of families are going through. You mentioned 3 kids at the kitchen table. You mentioned just 1 computer. I think when you think about it, I think most people think everybody has a laptop, and that's not the case, and that's really been a struggle.
Yeah, and we've worked hard in Rhode Island to get devices in front of kids. But I think that the bigger picture is you have 1-bedroom apartment, 3 kids sitting at a table, competing for the same space, the same time, and that's a struggle. That's a struggle. The other piece that we found this year as we went by, it was that we had a family that was homeless in Central Falls. The young lady called because she had a laptop, but she couldn't plug it in because they were living out of their car. I think that we take for granted everybody's situation. We're not coming from the same places. And I think that it has hurt our community because we keep talking about COVID as if it impacts all communities the same way, and it has not. We have seen that, and I think that that is something that we need to deal with. COVID has uncovered the inequities that we knew existed.
Commissioner, talk about some of these communities. You've had 8 superintendents that wrote to you and the governor at the end of last week, talking about their concerns about going back. Cranston, Coventry, West Warwick, Woonsocket, just some of the communities. What are you telling them? Because part of the problem is they're afraid of cleaning materials, the air quality in the buildings, but we want to get the kids back to school, especially the ones that are challenged. What are you telling them?
Well, I'll tell you what I'm telling all districts, because I never received that letter, neither did the governor. So just to be clear on that, but what I'm telling all districts is that it's our responsibility to try to create options for parents. It is our responsibility to have different options, that we do have to have the safety equipment. We do have to follow the measures. The governor announced this week that the PPE materials would be delivered, and many of the school districts have already received them, that the state would take care of that for the first few months. Also the testing. I think that we have a responsibility to all families and not make assumptions that, choice is a luxury. Not everyone has that luxury. And I think that we've seen this through this pandemic, and we continue to see the divide, the digital divide, but also the instructional divide. What is going to happen to our kids if they're not offered an opportunity to return back to school?
And those are the long-term effects so many people have talked about. Courtney?
Thanks, Michael. Mr. Peters, this one is for you. There have been a lot of changes in the Providence School District, but then a pandemic hit. So now I want to focus on the parents in the school district. There are a lot of parents in the district that have language barriers, and I wanted to know, will there be any assistance, or what are your concerns about parents and students that English is not their first language?
Yeah, thank you, Courtney. What a great question. We do serve a community of multilingual learners, and we value that and we celebrate that. We believe that's one of our greatest strengths. As a district, we have to, let me just step back for a second. We've recently rolled out our turnaround action plan, and a core pillar of that plan is engaged communities. So that plan was developed for the community, with the community, by the community. So that shows one of the things that we value in that community. Because we value that, we want to make certain that we are communicating as broadly as we can. We've amped up our translation services, our interpreters, our parent call center staff with multilingual learners. We're hiring more teachers that are bilingual. We're getting teacher training on how to support, develop, and instruct students with multilingual learner opportunities. So the whole gamut, we're trying to do a better job. We've heard loud and clear from our communities that they want a school district that's responsive to their needs and that are listening, and we're just trying to respond to those needs.
So it sounds like it's communication and a support system. Thank you.
No question.
Mike?
So Jim, we'll ask you this next question. There was research done by Brown University and the University of Virginia, and they said that the minority community has lost about a third of what they've learned in the last year through this pandemic. And I think we can all agree that the country wasn't equipped to shutting down the school system like we've seen it. Going forward, how do we get them back on track?
Well, I'd like to say that, the commissioner and the superintendent have talked about choices and options. And I think that one of the ways we do it is to make sure that any student that can go back and wants to go back, that's an option. And those that can do distance learning, and not all can do distance learning because not every parent can telecommute, for example, and then there are other parents that have students with or children with disabilities, as well as some of the language barriers. There's a problem. I just feel that we have to be mindful of, the safety and the health concerns, of course, because not just the students, but the faculty and staff. But our students are far behind already. So we have to, push ahead to see, if they can get back to school or do distance learning. The worst thing is to have this choice, but we have to do something. We're falling behind. There's no doubt about that. But we want to make sure that there's safety as well. I think that the governor's outlined different options in terms of different communities. It's going to be a blend. I think that, Rhode Island, which has done a good job in terms of pandemic, is prepared and poised to move forward.
All right, Jim, thank you very much. Courtney?
All right, and thank you for your answers, and we'll be right back after a quick break.
And welcome back to our latest 12 Town Hall as we continue to talk about the distance learning and the educational process going on in the state of Rhode Island. Mike Montecalvo and Courtney Carter, thank you very much for tuning in. Courtney?
Okay, so Dr. Hall, excuse me. The commissioner touched on this briefly earlier already in the segment. She had mentioned a quote or said a quote saying, many families have to go through the choice to either stay home from work or jeopardize putting food on the table, or at worst, leaving kids at home unsupervised. And Commissioner, I'd also like you to follow up on this if you could. Dr. Hall, why do you think this will be especially hard for lower income parents who have to work?
Yeah, obviously we're talking about childcare. So the reality is the school systems across this country do many things, right? So first and foremost, ideally they educate, right? So they educate our youth. But there's also a social service component that we have to be very serious about. Recently, research has come out that many of our students, Monday through Friday, from the time that they're in school, they're receiving 2/3 of their meals, right? So there's a nutrition component. We're also now asking teachers to do more, not only just teach, but to be parents, mentors, right? And so there's a lot of pressure and weight in terms of what's happening with this COVID situation. And so that exacerbates the situations at home, right? When we're talking about parents, many of whom make less than $40,000 a year, right? So it's not only about getting them a laptop. I want to be very clear when we talk about laptops, the conversation has to be more, right? So it's not only laptops, it's, okay, access to the laptop. Are you sharing that laptop, right? Is there access to adequate computer? Does the laptop actually have the software that you need? Then we talk about making sure that laptops have a Wi-Fi capability. So the school districts have to look at that. And then we talk about what the commissioner said, do students have headphones or earbuds so they can block out the sound around them? Because many of these students are gonna have little brother, little sister, older brother, older sister. And so when you're already talking about families that are living paycheck to paycheck, right? Just trying to make it, COVID has exacerbated that. And I wanna be clear, COVID's not the cause. We keep talking about COVID-19 as if it's the cause. These issues were there prior to COVID. When we look at how families are struggling, right? Struggling to make ends meet. So this is a real conversation that people have to continue to have. And it's a real conversation that involves race. Why does it involve race? Because we know when we talk about the impact of COVID, the NAACP just put out a study the other day, as well as the CDC, when we talk about communities that are impacted, high blood pressure, sickle cell anemia, prostate cancer, right? Diabetes. These are things that are happening at higher rates in communities of color, right? So not only are we concerned about the students, then we're concerned about the students who might go to school and bring that home to their parents or whoever they're living with. So this thing is very real.
Thank you, Dr. Hall. Commissioner, do you have anything you want to add to that?
Well, I'll just add, I agree with everything that Dr. Hall said. I think the other piece that we have to think about is also the ability of the family, one, to continue to go to work, because that's a reality for a lot of families. And two, how much support can they get in the household? We heard a lot from parents saying, well, they had to do a lot of the work, but if you don't speak English, if you're in a household where you don't speak English as a parent, or that you don't have the same education that your child is being exposed to right now, it's very difficult to really provide support. So it's economic. But I also wanted to add that to what Dr. Hall said, all these things, there isn't a predisposition in a gene of a person of color, right? I get asked all the time, well, why is it so many Latinos? Why is it so African Americans? As if, our body makeup is different. No, it's lack of access to adequate health care. It is poverty. What COVID-19 has done is, it's a dirty little secret in education. And we were sweeping it under the rug. And now COVID-19 has come and just pulled the rug up, and it's here. And we need to talk about that in a very different manner. It's all those things that have historically impacted communities in poverty, have historically impacted communities of color.
So, Commissioner, how do we reinvent ourselves, or how does the Education Department reinvent ourselves to what you're talking about, instead of sweeping it under the rug?
Well, I will say that some of the things that we're trying to do, and with the governor's vision and support, is for the communities that are most impacted, is that we're giving them more, right? So communities that will have to start maybe in a partial, what we're doing is strengthening the instruction, strengthening what happens, not just in the classroom, but what happens with the families. Like, what do we do? What kind of supports can we give the families so that they can, if they have to, stay at home, and that they have a different type of support system in place? So it can't just be about education. It has to be about the healthcare. It has to be about the economic development and support of these communities. So we're looking at these three communities, at least in Rhode Island, that have been greatly impacted. And what do we do to bring more into those communities to fix some of those inequities that we know have existed?
Well, Dr. Hall mentioned mentoring. We're going to take a little break. When we come back, we'll talk about how mentoring is key to all students, including the minority community in the state of Rhode Island. We'll be back right after this. Welcome back to our latest 12th Town Hall Distance Learning Divide. Just a few minutes ago, we were talking about mentoring. Dr. Hall was talking about it. Jim Vincent, you have been involved with Big Brothers and Big Sisters. You were honored several years ago. I remember that night we were talking and you said that a mentoring program for kids in the minority community, kids of color, is so important because they have nobody at home to look up to. Well, here we are in a pandemic, bigs and littles couldn't see each other for months. Talk about the impact that has had and how we need to get back to that mentoring program.
Well, there are some kids that do have mentors at home. I didn't mean to say that there's nobody there, but our kids need that interaction with people that can show them that there's other possibilities than what, is before them. So, we need that social interaction with human beings, with people. And distance learning it sounds great, but for our community, there's just too many challenges, as I mentioned, the digital divide and parents not being able to telecommute. So, that interaction in terms of with people is so important. However, we are in the middle of a pandemic and we've been disproportionately affected by the pandemic. So I understand people having that kind of concern. The thing about Rhode Island that I appreciate is the fact we got a great commissioner and a great superintendent in Providence and a great governor that is understanding that not everybody can it's not one size fit all. Not everybody can do distance learning. Not everybody should go back to school if they don't want to go back to school. And I think that because you have the options and the choices, I think we're going to make the best of a very bad situation. There's no really winning situation here. The pandemic is disproportionately affecting our health in terms of our parents and our grandparents and even other siblings and whatever. However, we are falling behind. We were behind before the pandemic. We cannot afford to fall back behind anymore. Mentoring is a component of that. So I think if any state can do it, it's Rhode Island because of the way that they've handled it. It's not a one size fits all. We have some communities in Rhode Island, like Central Falls and Providence or whatever, where they're not going to make people go back to school. They're going to have that option. So I like the idea of the fact that it's not a one size fits all and that people are looking at all the options. They understand that this is not an easy solution going forward. We're in a bad situation educationally in the state, particularly among communities of color. However, the virus is affecting our health disproportionately as well. So this is not easy for anybody, but I think that with the governor and the commissioner and the superintendent, the way they're handling it, I trust them. I think it's the best way to go.
And it's not been easy for all the teachers and educators, too, that have worked overtime trying to put class curriculums together. Courtney?
They are heroes to me because this has been something that they've had to do quickly. I know they're scrambling, so God bless them for doing what they're doing and being the people that they are. And I'm concerned about their health as well. So, I mean, it's not easy. It's not easy. But I know that in terms of learning, that's the great equalizer. We were behind going in, and we're falling further behind. And distance learning in terms of parents not being able to telecommute, the digital divide. Representative Marcia Randall has a bill. We need to give as much resources to our community in the inner city as possible. So the financial resources has to be there. Distance learning without financial resources is a folly. It's not going to work, if you don't put the resources to make sure everybody has broadband.
I know, Commissioner, I think you wanted to say something about the teachers, too.
No, I just wanted to say that these are difficult times, and the teachers have gone above and beyond, and we appreciate their work and what they've put into this. And many of them want to come back. It is our responsibility to make sure that they can return safely, right? That is the responsibility to the people that we entrust with our children. So they have done an amazing job, but I think that many of them are ready to come back. Some of them are afraid, but they're afraid of what could happen. But I think that it is our responsibility to make sure that it is safe for everyone. And if it's not, we will make sure that nobody is in that position.
All right. Commissioner, thank you very much. Courtney?
Well, Commissioner, you just spoke about some teachers actually wanting to go back. I know a couple weeks ago or 2 weeks ago, work seemingly decided that they were doing remote learning. Will you and the governor at least partially ask work to go back, or what will happen with that?
So we've been having conversations after that statement was made. We've been working really closely with the superintendent. And it's not that they have kids coming back. They have their differently abled kids coming back. They have their multilingual learner kids coming back. So we're in conversations with them because there are parents in Warwick who want their kids to come back. We get emails every single day saying, what do I do? Because this is not fair to my child. So we're working closely with them to figure out solutions for those families that really need their kids to go back and that just didn't benefit. That's not the way that they learn best.
Thank you, Mr. Peters. Just following up on that, have you heard from any parents from emails or phone calls that want their kids to go back?
No question. We have tried to be responsive to as many parents as possible. You may have heard that there's a huge appetite in our communities for a completely virtual academy. So the last few weeks, we've been running registration. Right now, we're about north of 6,500 families that say, hey, we don't want to come back. We want a virtual option. But what that leaves, Courtney, is about 19,000 students who have said with their voice, we want to come back to school. And we've tried to provide that option. Jim talked a few minutes ago about giving families choice. So there are families that say, hey, we're not quite ready. We don't feel safe. Maybe my student has an autoimmune compromised medical condition, don't want to risk being around other students. That's fine. We'll have a completely virtual academy. But again,
Superintendent, we're going to hold you there for a second.
Loud and clear.
We're going to hold you there for a second. We're going to continue this conversation right now as we're running out of time on air. Just go to our website, WPRI.com. We'll have more in-depth coverage. We'll talk about that virtual academy and also about sports coming up on WPRI.com.